Today, we are excited to welcome Brian Lane. Brian is President and CEO of WellLink and its divisions WellLink Health Alliance, WellLink Group Purchasing, and WellLink Innovations. Brian leads with an entrepreneurial energy and a deep commitment to innovation. Since joining the organization in 2019, he has spearheaded the development of a new mission, vision, and strategic plan, and the organization has achieved 14 local and national workforce awards since then. Brian brings more than 20 years of experience and has held strategic executive positions for leading technology companies, Fortune 500 companies, Big Five consulting practices, clinical practices, medical communication firms, and associations. He is an alumni member of the Leadership Cleveland class of 2021 and the LC2 class of 2022, and he serves on the Health Comp Board and Foundation Board, the WellLink Board and Health Alliance Board, the American Hospital Association Regional Policy Board for Region 5, and the Ohio Hospital Association Board. And we are excited and proud to have him a member of the Cleveland Leadership Center's Board of Trustees. Brian is a fellow of the American College of Healthcare Executives, fellow of Health Information Management Systems Society, and fellow of the American College of Data Management. He is also an affiliate faculty member at Baldwin-Wallace University. Please welcome Brian Lane.
Everybody got it. I'm a fellow. How about that? Well, it's a pleasure being here, and I'm honored, honestly. And I just want to give out a huge shout out to CLC team, Rachel, Becky, as well as everybody else. And then on top of it, we have our chair, Kip Boland, who's also participating in the house. Love you very, very much, man. And so with that, I'm going to some slides up. I want to say a couple of things besides thank you. And one, I just appreciate the opportunity to provide this presentation. Our team, which there's a lot of members of our team on this call, thank you for all being here and supporting me. And so I want you all to grab your drinks, your food for lunch. I know we're going to be on this call for 4 hours, which is going to be interesting. Along with us, we've never done this, a luncheon for 4 hours. So it's going to be like a senator speaking. So get ready, buckle in, and here we go. So let's see if it'll advance the slides. There we go. When you lead an organization, you've got to make sure you're all singing from the same song sheet, right? And for us, within WellLink, which is formerly known as the Center for Health Affairs, we're the organization next to GCP. And for those of you that like to get Subway, we're like a door or two down, okay? But we are here. We've been here since in this building since 1982. We are the Hospital Healthcare Association for our NEO area. We've been in place for a very, very long time. I'm going to share that with you in just a minute. But here's our mission. Our mission is simple. We're a convener, we're an influencer, we're an innovator, and we are the group that helps bring together decision makers and issues and then solve for them. And so we're a means of taking ideation and turning it into implementation and then rolling that out throughout the whole country. So I love the background of this just because everything within healthcare is an Everest climb. And so here's some fun facts. And there's even a drinking trivia piece on here too for all of you to take away. This organization got its roots when the American Hospital Association, which was started here in 1898 out of Arcade 5, always like to give a historical reference point, became a national association. So the American Hospital Association goes national, leaves a void. Think of it as a crater. We fulfill that requirement of a need to gather citizens, decision makers, governing bodies to actually help create hospitals and healthcare delivery systems, as well as a system to support the uplift of our overall community. And this starts in 1914 out of Arcade 5. Arcade 4 for AHA, Arcade 5 for the Center for Health Affairs, which now is WellLink, right? And so when we created that, I want to share with you some other firsts. We helped create the accounting codes, right? We also helped create this thing called Blue Cross Blue Shield. Took the idea from Baylor, Texas, operationalized it, that later became MedMutual. We had to divest ourselves of that in 1967, okay? So a lot of firsts out of this place. One of the most proud firsts is up here on the very top, which is our social determinants of health platform and hub, which isn't just local, it's a national and global play directly with the executive teams over at Amazon. And I'll share more about that in just a bit. So what type of representation do we have? Well, we've got a vast network, right? Over 37 core facilities that are tied to us in a variety of different ways and different capacities. But I want you to look at that number on the bottom left-hand side regarding that NPR, that net patient revenue. So this is a big epicenter, folks, regarding healthcare within our country. And so this organization represents a lot of different players around a lot of different issues around finance, revenue cycle, workforce, nursing, quality, safety, emergency services. And so those things become programs as well as discussion points for my team and for all the different market leaders to actually build programs and support mechanisms to help uplift this overall community. Now, my team is super proud of our achievements. Okay. Rachel commented that we have 14 national awards. The number actually is 38. We have 38 local, state, and national awards that we have succeeded in obtaining from Fortune, Forbes, Inc., Modern Healthcare, which are all huge seminal pieces for this place to achieve. But it's because of the team that's actually on this call, okay? But here's what we've done and what we do every single year. We give back. We give back in volunteer time, we give back in philanthropy, and we also give back because our group purchasing organization, which I'm going to explain in just a bit, builds enough profitability but to support the programs, but also we save organizations a significant amount of money that enables organizations to sustain and create additional jobs. So the savings alone within Ohio, if you notice on the bottom there, has created over 277 jobs with a median salary of over $54,000. Not many organizations can say that, all right? That's what we're proud of. We're proud of affecting our economy. We're affecting poverty. We're affecting our infrastructure here. As I said, you'll see me do this numerous times, creating uplift, okay? Now, we just got done hiring a very unique soul who's probably on this call as well, is Daniel Lettenberger-Klein. Many people know him because of Stella Maris. Everybody wonders what he's doing. You're looking at the slide of what he's doing. He's now in charge of the programming for our community regarding this organization. So the outreach, the programs, the education, the CE, CME, the volunteer efforts combined with our HR, that's coming through that gentleman along with our team. And so that is touching SDOH, emergency preparedness, workforce, finance, policy. We've got a star team that delivers upon all of that, and we've got now a star leader attached to us as well. Now, I want to take a moment, and I want everybody to listen when I talk about this thing. Not that you weren't listening before, but really put down the sandwich, put down the drink. This is where the rubber is going to meet the road for just a little bit, and we're going to talk about social determinants of health. And I'm going to give you some factoids, which will make your stomach curdle a little bit. So first off, you can read the stats there. I'm going to recite some additional stats, okay? First stat I want you to know for the Cleveland area is that we have 367,000 citizens who are registered under census, okay? That should surprise you, right? Because it's probably a much greater populace here than just 367. That means that a lot of individuals didn't register under census. But here's the stat that's the killer piece of this, and legitimately killer piece. 119,000 of those individuals fall underneath the federal poverty line. Okay? So 1/3 of our populace is in dire need. Okay? 1/3 has been affected because of SNAP. 1/3 is being affected because of regulatory changes within our marketplace. Okay. And so our focus is on our community to create that uplift. We've got to come together. And so the other stats here, okay, just quickly, and we just got done showing this at Chime in San Antonio last week, right? The Cleveland households, have a median income of over 30,000, or just around $30,000. Okay, I just told you that the threshold for federal poverty is that number. Okay, so that means there's a greater propensity for individuals here to fall within the poverty area versus the non-poverty. Okay, I also want to state that close to 60+% of our children, it's actually 64, are in poverty. Okay, and so this is an issue that we've got to address, and we have to address together with all our respective organizations, as well as our time, our volunteerism, and our focus. Okay, what do these stats mean for us? Well, what we did was we pooled together different leaders, 250 organizations, 85 of which became core advisors, and we built the SDOH Innovation Hub to study social determinants of health locally, nationally, and globally with Andy Jassy, who's the CEO of Amazon, which is a very strange statement to make, okay? But he gave us the infrastructure. And I know Dan Dugan's on here. Dan, much love to you in Amazon for this gift. But this gift has given us the eyes to actually understand that data leads us into a better understanding of where we should be putting our money, a better understanding of where we should be putting our time, and doing it not in a shotgun effect, but doing it in a very succinct way to create that uplift, to create that economic drive. Okay. So the stats on here are shocking. I know they are. Believe me, we went into this with the eyes of going, hey, we're fourth most violent area according to national statistics, but we didn't fully understand or appreciate that the majority of the violence or the deaths due to firearms is suicide. Nor do we understand, as you're seeing on the statistics here, that melanated individuals are the ones who have the highest propensity. Okay. So then you got to dig into what is the cause and where is this from an area, from a geography standpoint. And as you can see, we have literally 3 main neighborhoods that have extreme needs: the 44102, 44105, and 44108 areas. So what can we do to help create that uplift? Well, number one, we can start working with our partners to actually create suicide prevention education. And we've done that. We've also tied directly into Adam's board and team and groups like Stella Maris and the hospice and other organizations to help in developing solutions to help solve for isolationism, for transportation issues, for housing issues, and for food disparity. Okay. And so in this, what I want you to understand is that it's not one thing, it's the combination of things that has helped create this problem, okay? And that problem regarding poverty has to be addressed with housing, jobs, food, access, right? We need to enable individuals to prosper, right? Now, I'm going to change the topic and go back into the org. For those that have a number attached to you from a financial standpoint with your orgs, hit that QR code and allow us to help bring in additional support for you to help sustain you and cut your costs. We typically, and I hope the GPO people are doing this on the line here, our group purchasing organization helps decrease supply costs for organizations. Reach out to them, okay? Reach out to them so they can assist you in enabling you to have stronger power for free, the ability to reduce your costs, sustain your org, and help you actually achieve higher margins, right? In order to create better outcomes to hire more people. That's what we want you to do, okay? And we do that on a national basis. We have 28,500 customers. That's going to grow exponentially in the next month. So look for some more press on that. But I'm super proud of that team. That team kicks some major butt, and they derive more value for our community than ever imaginable. All right, what are other ways you can partner with our org? One, join the GPO, but you might also have solutions that you want us to actually go market to those 28,500. Ping us, make us aware, right? If you want to actually present to our membership base or at different events, send us a proposal, right? You can host events with us. We love working with other folks. That equation on the very first slide, this 1 + 1 = 6, I live by it. It's institutional here, right? Because we're one limitless link. That's what WellLink is all about, adding up greater value, okay? This is how you can connect with us. But let me now talk about something more dear, right? And that is TLC. I absolutely love this organization. So I chose not to speak about myself, but to talk about Becky, Rachel, Kip, Angela, Jolene, and others of this team. Because what they're doing is they're creating leadership impact. And my ask of all of you is to not only participate within these luncheons, but tap into this organization in different ways, different forms, different functions, and join it. What can it do for you? Well, not only can it be the best networking opportunity of your whole life, but it can get you involved. It can wake you up. It can provide you training. And I even say very openly to folks, and those that are in the university and college environments, and Ann, I think you're on here too. I love our universities, but I want you to know in my heart of heart, this is just as good of an educational event and venue and experience for all of you to participate in as going through different colleges, okay? That's a big statement. All right, what's been my involvement? Well, I got this wonderful opportunity to not only become part of it, but then become board of directors. And then Kip has given me the opportunity to help run our development committee, and so thank you for that. But I also provide advice to our Civic Leadership Institute too. So why do you put all this time into this? Because it's the right thing to do. It has so much purpose in the creation and the elevation of people and being tied in from a coaching and mentorship perspective, and the ability to help change the programs and the effect with all of you. That means the world to me, absolute world. And so I want you to join. So here are my asks. Number one, join CLC. Now, of course, you could join the GPO too. Folks from GPO, I know you're many on here. I've already given you the plug, but regarding CLC, look at the amount of areas that you can actually join us. There isn't a place within your career that you couldn't take part directly in, from Leadership Cleveland all the way through our Advanced Leadership Institute program, which we just put into place this year. They are truly great experiences to understand the community, the needs, and become a part of those efforts like the SDOH thing directly with us. Now, other lessons. I'd be remiss if I didn't start off with this one, right? And that is leaders show up, right? Leaders show up. All of you showed up today. Thank you for doing that. I want you to always show up in all your meetings, right? Lead, listen, love, right? I want you to get involved within the community. And I want you to ask, hey, how can I get involved with organizations such as WellLink? Okay. I live by three main words: can, will, want. They've always spelled success for me. I can, I will, I want, I will, I can. There is no downfall with those words. So if you're wondering what the booster shot is for me and my success, I live by that, right? A little bit of a Robbins, type of appeal, but I these are my things. I used to spray paint them on my dorm room walls, starting in college. So I'm just sharing with you a little story there. The next thing I just want to say is have a happy holiday season, but the holidays aren't anything without great friends. And for all of you who joined today, you're all my friends. I consider you all family as well. Super, super blessed. And I just want you all to be extremely thankful. So with that, we'll open it up for questions. How was that, Rachel?
Brian, that was great. And thank you for all of the CLC love. We are so appreciative of all of the support that you give to the organization and our programs.
No, we seriously, for folks that don't know this, we're literally next door to one another. Okay. So it's a very far walk for all of us. But we are super, super tight. We care so much about your team. Mikasa Sukasa and our whole organization thinks that way. So I'm anxious to take everybody that's on this call that isn't part of CLC from my team and make them CLC alums. So know that that's coming, folks.
We love it. Thank you.
Good, 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 good.
So let's jump in around the social determinants of health hub. What have you learned so far through that data that has surprised you?
Well, that violence piece was probably the one of the biggest lessons, but I'm going to use Randy McShepard's words because many of you all know Randy and respect Randy. He's now the chairperson for the Cleveland Foundation. He's a top leader at RPM. Randy saw the platform and he goes, "I've been looking for this for 20 some years. I've been looking to actually try to create a means of a provision in an environment where everybody can tap into it for free. That's the zero sign for everybody. In order to share their data and then get to cause to then link to solutions, right? And then have that data become the vehicle for change. And so for me, it's been a very eye-opening experience in seeing what data can actually do and seeing how it can transform people's thinkings and thoughts as well as beliefs. And I've seen a tremendous amount of eyes become much wider and hearts become even larger. And I know it sounds like the Grinch, but I'm telling you flat out that it has brought a significant amount of attention to poverty into areas that have had severe plight and blight in order to create uplift. And for me, that's been the most rewarding and also been some of the most shocking. No.
Can you talk a bit more about the support you offer to organizations who address some aspects of wellness? Is it intervention based? Is it back office support? How do you support organizations?
Yeah, so we support them from an advocacy standpoint. We can support organizations from a back office perspective. A lot of non-for-profits have reached out to us for our shared services because they're super strong. We're an organization that has had a prosperous, growth associated with us, but that's because of this amazing team. And so we're able to then assist organizations that are having some tough times, due to economics, due to regulatory, issues, due to tariffs. And so this is a group definitely to tap into to explore all of those types of efforts. I would also be remiss if I didn't say openly, we're the group that if you've got a program and you want to get the message out and you want to do it locally but also nationally, it should come to us around healthcare because we'll help get that message out and we'll help make it an educational event. So did that answer your question? Probably gave you a little more than you
That's
asked there.
great. And WellLink is a recent rebrand of the
It
Center
is.
for Health Affairs. Can you talk about how kind of the process and the why of the rebrand and what that means for the organization?
I can, and thank you, the marketing team, for probably teeing that up. The brand itself, the Center for Health Affairs, has been around for literally a number of decades, but it's always been one that people scratch their head on. Is it a policy group? Is it an association? Is it a gathering? Is it a clinic? What is it? And so it didn't resonate. And then it resonated so much though that others all became the center, right? Or centers throughout the city. So we needed something to set us apart. And then I would say openly, we've learned because we have the GPO, because we have another group called Innovations, which is an investment group, along with developing new solutions for this marketplace, that we need a broader, overarching umbrella brand, a brand that would tie in all our efforts around well-being, tie in our efforts around that uplift, and literally become that, if you want to call it the hub, where all these different activities and the spokes touch different healthcare provider organizations locally as well as nationally, right? The WellLink brand resonates, and so we fought hard for it in us, helped lead the charge, and it's been a phenomenal change. New signage will be in and on the building in less than 4 weeks. Just sharing for those that are around us. So yeah.
And Brian, I know you are a big picture thinker. So I know you're looking 10 years down the road. What's that vision for WellLink? And think about the impact in the community.
Leading. That's a leading question. I will say very openly, I think in 10 years, our group purchasing organization will have uh, at least 50 some thousand customers on a national basis. I think that we'll be a national association representing all healthcare providers, from hospitals all the way down to physician groups, laboratory, pharmacy. I think that you'll see a lot of events and annualized events come into the Cleveland marketplace in order to uplift tourism. I think you're going to see a number of data specific and AI specific solutions that the hospitals and healthcare organizations need are going to be developed either with us or with our partners, hosted hopefully on Amazon, and then pushed out into the marketplace to help sustain them. I think you're going to see changes associated with social determinants of health from a focus standpoint by a number of cities utilizing that platform, who are all coming to us already, including countries such as Nigeria, that want to host all their electronic medical records onto the platform. So Dan, perk up your ears on that one. I think that's pretty good. Yeah.
Just a few things, right?
Just a few things, yeah, but the team can do it. I want you to know that's the beauty of this. And I also believe that organizationally, we've got the right leaders that will help lead it into the next 20 or 30 years that are now in place. And I'm super excited and very, very proud. And I'm pleased to have had the opportunity to be here not only with you, but pleased to have been given this opportunity to take the leadership helm of the Center for Health Affairs, now WellLink. And it's to me, it's about changing the community. And I hope all of you have felt that throughout this whole presentation. And if you didn't, my apologies. I'll do better the next time. But that's my message. Help the community, uplift it.
Well, Brian, I think that's the perfect way to wrap up our leader lunch break today. So thank you for your leadership. Thank you for all that WellLink and your amazing team do to help make a difference in our community. And we are certainly happy to have you here in Cleveland.
Thank you.